this is something that we've been working on pretty much, I think, since before Easter, so it has taken a bit of time. There's 19 metrics in total taken into consideration. It's all on data available on the HSE website and through parliamentary questions answered by the HSE. So I have 19 metrics for the 9 Model 4 hospitals. And in pretty much all of the metrics, UHL is falling down. Basically, our research indicates decades of underinvestment coming home to roost in Limerick. We have the smallest number of consultants of any Model 4 hospital. We started off from 2020 with the lowest number of acute beds of any Model 4 hospital in the country. And it's only an extra, I think, 204 beds open since. And even though we have another 96-bed block, we're still way behind in terms of bed numbers. We're miles behind in terms of consultants. Now, I know that Kieran O'Donnell spoke in the Dáil there 2 weeks ago and said that staffing was up 57% in Limerick since 2019. But we still have the lowest number of consultants of any Model 4 hospital in the country. And when you're looking at it, there's 145 filled consultants posts. There are 287 in Cork University Hospital, which is almost double. Cork has 40% more nursing whole-time equivalents. In Limerick, there was 203 patients admitted for every consultant. The next highest, that's 203 in Limerick, the next highest is in Tala, which is at 95. So the workforce in Limerick are under a huge amount of pressure. They're handling a higher workload than any other Model 4 hospital in the country. And, it's all well and good to say that there's 57% more staff and there's 16% more beds, etc., etc., etc. But when you're starting from a low base, which Limerick is, then it's just not enough. It's just not cutting it. We're now nowhere close to where we need to be, considering the number of attendances and admissions through the ED. And this is only looking at activity in terms of acute capacity, so it's emergency department attendances and admissions. And Limerick has the highest rate of admissions of any Model 4 hospital in the country, with 31% of people who attend ED end up being admitted.
Yeah, still not where we need to be.
And Angela, in most of the other ones.
Just so we understand the method here, when you're saying highest and lowest, are you talking about overall figures, raw figures, or are you saying that this is taking population into account?
No, so these are our raw figures. So I have the ED attendances for all of the Model 4 hospitals, and Limerick has the highest. So that gave it a rating of number 7 because it was the highest, so the most pressure. And then when we're looking at, then I looked at the attendances and the admissions per consultant. So it's not actually related to the population of a region, it's your attendances and admissions per consultant or per hospital bed. And in each one of these, whether you're looking at the number of patients per bed or the number of consultants per bed or the number of consultants whole-time equivalent per attendance, Limerick is falling down across the board.
It's likely that if the Department of Health or the HSE looked at this data, they might point to other facilities in the region. They might say that there's a bigger picture and there's more to the story, and they might look at local injury units or other facilities around the Midwest. Do you think that the staffing there and facilities there should be taken into account?
Well, Ennis has the lowest number of consultants of any Model 2 hospital in the country. So that would be the first thing I would say. But I will also say, let's say if you're talking about having Model 2s and local injuries units, Cork University Hospital has 2 Model 2s in their region. They've one in Mallow, they've one in Bantry. And, they have, their attendances are 88,000 last year, where our attendances in UHL were 95,000. So I'm not even looking at the population. I'm looking at the number of people that are coming in the door. And UHL has the highest acuity, it has the highest conversion rate, so it has the highest percentage of people attending that are ending up being admitted, because the acuity of patients that are going to Limerick is higher than anywhere else. Because again, Limerick has the oldest population of any region. It has the highest number of people with multimorbidities. It has all of these factors, and it has social deprivation that mean that more people that end up in Limerick end up being admitted than any other hospital. And there is, regionally, our region is getting, we represent 8% of the population of the country. but we're getting like 6.5% of the expenditure.
Mm-hmm.
So it's underinvestment. It's underinvestment that has gone on for decades. And that underinvestment is resulting in the huge trolley numbers that we're seeing in Limerick. And it's resulting in a huge workload on the staff in Limerick and a huge pressure on the staff in Limerick.
The facility we're speaking about, University Hospital Limerick, obviously serves the entire population of the Midwest, but you are speaking as a spokesperson of Friends of Ennis Hospital. What do these statistics mean for the people of County Clare?
Well, Ennis Hospital needs more consultants, and that's something that we said straight out to the Minister for Health when we met her last month. If we want more services to come into Ennis, which we obviously do, then more consultants are going to have to follow. The Minister was talking about X-rays in Ennis not being looked at in the afternoon. That's because we don't have enough radiologists and radiographers, and we could do it more of them in Ennis. We could do with the local injuries units hours maybe being looked at, and the medical assessment unit at the moment, because of the acuity of patients that are coming in by ambulance through Ennis, a lot of them are actually bypassing the MAU in Limerick or in Ennis and going to UHL because the MAU doesn't have the staffing that it needs and the consultants that it would need for more people to be treated in Ennis. So the bottom line for Ennis Hospital is Ennis Hospital needs a huge amount of investment. And even with the new beds that are coming on stream that are planned for Ennis, the higher acuity is still going to end up in Limerick. So we need investment in Ennis, we need investment in Johns and in Nina, and we need a huge amount of investment in Limerick. And buying a site in Raheen is grand, but a site is not a hospital. And in the long term, we're going to need a hospital, and an acute hospital in Clare for Clare, because the population stats back that up, and the attendances back it up, and population profile backs it up. And Clare is the one county in our region that has the highest growth in population.